Okay, so we're going to do a child prophy here today. I'm going to show you some of what goes on with that. With a child prophy, in your office, you need to come up with your age limit as far as when you're going to take your piano. Some pediatric dentists say that you should start at age 6. Some offices do it at different times, but you have to have this known in your office so that your assistants and your hygienists take it at that exact age, okay? The other thing too is, what are the codes that we're going to be walking out for a child prophy? We're usually going to use the exploding codes of New Patient Child Prophy, or NPCP, or Recall Patient Child Prophy, RPCP. So make sure that you do those. What does that include? It includes the 2 bite wings instead of 4 for adults. It also includes the fluoride. So just be super aware of those exploding codes and all of the procedures. Now, obviously with kids, the first thing you want to check is let's check the status of all of their mixed dentition, their baby teeth versus adult teeth. Now, you should be charting those on your chart, and you should also be updating those as some of those primary teeth exfoliate, okay? Obviously you want to be checking their sealant status and making sure that you have all of the sealants on all of their 6 and 12-year molars. You do not get paid for premolar sealants. It's never been paid in the lifetime of insurance. Another thing too is we're going to kind of go through breakout points here. So usually I'm able to scale the lower, and then I'm going to floss. The provider is the one who needs to floss. Why? Because assistants are not trained to pick up calculus. So if there's any calculus, you need to be able to pick that up through your own flossing. Doctors also do need to do scaling, okay? I understand that it's very quick sometimes, but that scale needs to go into the patient's mouth. You have to kind of pretend when the patient is all alone that their parent is here, and the parent is going to want to see that happening, okay? Some of the other things too to consider is your assistants need to have the fluoride out. They need to check and make sure that all of that kind of stuff is out. When it is a hygienist who's doing the cleaning, the hygienist should be setting the fluoride out. That's the indication that the doctor, after the exam, applies the fluoride. That means that the hygienist doesn't have to re-glove and put on the fluoride. So just some of those considerations. As far as children also, just make sure that you apply a light amount of fluoride. If you're really gooping it on, they can gag. So on the 3 to 4 to 5-year-olds, I go very light, and then I go a little bit heavier on the 6 and up. You also want to make sure that you know the frequencies and the age limitations. If you look on your desktop background, it's going to tell you all of the background or all of the age limits as far as sealants for Medicaid and for insurance companies. So you'll have all of those memorized, and you have to be very good at that stuff so that you can see these kids as quickly and as efficiently as possible and not miss things. I think that that's the big thing with younger doctors, is they miss a lot with kids, okay? So we'll show you how this prophy works, and you'll also get a sense of kind of the time frames that work around a child prophy. Okay.
And fluoride's cool with all your kids?
Yes.
Okay.
The practice what I preach.
You know, I assumed it, that's why I just pulled it out.
Okay, so for a child prophy, I only use the posterior scaler. In fact, for all prophies, I only use the posterior scaler. So I always like to start out on the buckle of number 31, okay? I like starting on the lower, which is the harder arch, okay? So that I can get through it here, okay? So you can see there's not a lot of plaque that's built up here, okay? We'll come here to the buckle here, we'll come to the buckle here, and we'll just kind of go around and making sure that there's no excess plaque here, okay? You're gonna notice that any of this really super soft plaque is gonna be taken by the floss and the polish. So I'm just kind of concentrating on things in between the teeth and on that facial surface. Open there for me. Okay, and then the assistant is, if you have an assistant that is available, she has the 2x2 gauze, and she just takes some of the excess there, okay? Open big. Okay, so the same routine, this is what I do on every single Prophy, okay? So I'm gonna touch every single surface and go interproximally, first of all buccally, and then interproximally. And then when I'm coming around, I'm going lingually, interproximally, lingually, interproximally, lingual, and then open big, and then coming in interproximally here, okay? And obviously this is the spot where plaque really can build up, is on the linguals of those lower anteriors. Open big. So I'm just gonna keep on coming around, okay? Okay, okay, and then again, there's our handoff, and the assistant's gonna pick that up with her finger, or her pinky, okay? So then, the next portion is to come in and do a rinse here, okay? So again, scaling, and then rinse.
Close your lips around that.
Close your lips around that. Okay. And then open. And then provider, floss. Okay. Okay. And then another rinse. Okay. And that second rinse is important just because it kind of gives the patient a little bit more feeling like we're getting them a lot more clean. And then I'm actually going to do this breakout point. So I'm going to go into another operatory and work on another patient, okay? And while I have my assistant polish the lower arch, okay? So we'll have the video show the assistant polishing. Now, on the polishing, super important if you're an assistant, okay? So you need to go on every single surface. So you're going to go on the buccal, you're going to go on the occlusal, you're going to go on the lingual. So let's do that. Now, if you are super running behind, what you're going to do is you're going to ask your assistant to do a thorough cleaning. The word thorough means she needs to be in there for a little bit longer because you have a lot of other stuff going on, okay? So the word thorough is our key word to say you're going to be in here for a little bit, okay? So she's going to polish on those lowers, and then this is the words that you use with your patients. So she's going to polish on the lowers, and then we're going to come in and keep on going around. You don't say then we're going to go on the uppers because maybe we're not done with the lowers. This is just the breakout point that we need so that we can have time to go see the other patients, okay? So let's get you all polished up. And then you do need to be there talking about the polishing.
So when we're polishing, if you want to bring the camera in, we want to make sure that we are going down on that gum line and around that tooth. Let's see if we can get some back here. Can you see in there, or do you need the light? Okay. So down and around each and every single tooth. And then after we've gone down and around on all of the front halves of your teeth, then you're going, I always give them a little suction. Close your lips around that. And open. Perfect. I always get just a little bit more polish And then I go in and I do just the insides. And same applies to the inside as the out. Go down along that gum line of each of those teeth. All right. Good. And just a little bit more. And now we're gonna do the biting surfaces of each of these teeth. Good. And then after each arch, I always give them a little rinse because that's a lot of polish sitting in their mouth. Okay, close your lips around that. And open. Right together. Is it sandy? A little. Which side?
Both.
Everywhere?
Kind of.
Okay. Okay, close. Open. Better? All right, perfect.
Okay, so we're back from our breakout point. Polish on the lower has been done. Okay, so then we're going to come in and scale on the uppers. Okay, I've already walked out all of the procedures. I walked out recall patient child prophy. Okay, so pretty simple here. You know, throughout the video, you can kind of see in real time how long the whole procedure takes. Honestly, you know, 10, 15 minutes is probably all we need for a child prophy. Okay. So again, now I'm going on the upper. I'm going to go to the buccal. I'm going to go to the interproximal. I'm going to go to the buccal, interproximal. Going to go on that buccal, interproximal. And again, I'm just super consistent. Why? Because I don't want the patient to have any excuses to say that I didn't do a good cleaning. No, they are feeling that I'm touching every single surface there, okay? So there we go. There is our scale. Now we're gonna come in for our first rinse, okay? Okay. And then we're gonna come in for our floss, okay. And then we're going to come in for our second rinse, okay. Now in this instance, we're going to have the assistant do the upper polish, and then she is also going to apply the fluoride. And then, you know, depending on the age of the patient, you offer them to see the treasure box. And again, the provider walks up the routing sheet. So, pretty simple procedure. A lot of doctors ask how you build your pediatric patients. Really, you need to, anytime a pediatric patient is in the office with a parent or whatever, check your routing sheet. And make sure that all patients who are listed on that family have their next preventative appointment. Talk to the parents about, hey, I love to see kids. And I think the big thing is being super friendly with kids, being super confident with kids, and making the procedures very easy for them. As soon as you start getting into a situation where they're either crying because they're in the office or you're pushing them clinically through things, they're not going to want to be here. And plus, the second that a child cries, the entire office hears it, and no parent that is in the office is going to want to have their kid come to your office if everyone's crying. So I usually refer out very quickly, okay? I do not push children clinically, and the key word for my assistants is when I say referral, okay, let's get the child referred out, there's no negotiation with the parents. The parents are going to probably try to have you continue to push on, but to me, the game over, let's get them out to a comfortable position so that they don't have an emotional scar later on in life. And that's the things that pediatric dentists don't see, is all of the emotional scars that can be created on kids. So don't push kids clinically. Again, that's our child Prophy. We'll go ahead and watch the assistant do the polish on the upper, fluoride, and I will take this to the front office.
All right, same thing on these uppers. You're gonna come in, and I always start on the outside of the teeth, and I just go around all of these gum lines. Perfect. You doing okay, or do you need some suction?
I'm good.
Okay, open it. And same with those back sides, all the way around the gum line. Still doing okay?
Yeah.
All right. And now to get those occlusals and biting surface. Okay. Alright, and we'll try that. Okay. Right together. Sandy,
Yeah.
everywhere again?
Yeah.
Okay, close. And open. Better? Alright, perfect. So now we're gonna apply the fluoride. Okay, so I kind of just give it a little mix here. And good. And I kind of just put it on those occlusals in the back, kind of go all the way around. And then start to go on the teeth. Okay. Now let's give them just a little section at the end. And close your lips. Perfect. Open.